So could you possibly do a quick introduction of your role?
Okay, I'm Lesley Hunter and I'm a sexual health improvement practitioner. And I'm basically a youth worker that specialises in sexual health. So it's very much around supporting young people to access services or to improve the sexual health.
So what do you think are the main health issues then for young people within sexual health?
I think really around risk-taking behaviour. What I come across more than anything is poor mental health, very low self-esteem, which leads to unwanted or early sex that perhaps young people regret later on, teenage pregnancy and sexually transmitted infections.
So what services do you provide then for these young people who have these issues, shall we say?
Yeah. Access to myself, so my role, or people who do my role, so a sexual health improvement practitioner. And like I said, we can work with young people around their self-esteem, trying to support them to look at the risk-taking behaviour and how perhaps that's not good for them, to access services and to give them support to be able to do that. There are contraceptive and sexual health services, so that tends to be things around contraception and STI testing. Emergency contraception, which is available in a variety of places. C-card, condom distribution, chlamydia screening and termination of pregnancy.
So how would a young person access these services then?
In a variety of ways. There's self-referral for all of those services, so a young person can contact them of their own accord or can be referred to some of the services by somebody else. So for instance, somebody who might be already engaged with a youth worker or a social worker, and that worker identifies poor sexual health or a need for some support around that, then they can refer that young person and the support to be able to do that. Access to services are in venues, or services are very much placed in venues that are accessible to young people. So for instance, CTheBox has got chlamydia screening and C-card. School nurses offer teen health clinic from here once a week. So they're often, those services are in young people's settings. And what we also try and do is get services to work with a programme that we call Your Welcome. I don't know whether you're aware of it, but it's very much around settings being young people friendly. So about working with young people for them to say, this is what we'd like our service to look like, this is how we'd like to be treated when we're here. So access to services is very much around making sure that it's accessible, really.
So what advice would you give to a young person that may be in this situation?
I think looking at it from a starting point of view really is about not having sex until you're ready for it, so not taking risks, don't be put under pressure by your peers. So many young people say that they're doing it and they're not, and put pressure on others for them to engage in that activity really before they're ready for it. That young people should value themselves and look at sort of, actually this is not what I want for me. So it's thinking about yourself and saying, I value myself too much to take those risks, and put myself at risk of some of those things. And that really don't be fearful of services, they will be respectful of you. If you need some help or support, get it. Look at getting contraception before you do have sex. So don't be fearful of the services, use them before you need them.
Okay, that's everything then, so thank you.